Good morning, everybody. It's great to see you here this morning. I think we had about, I want to say we had about 30 registered, and I know that some people jumped off to get some stretching in or a bathroom break or something to that effect. I'm just going to give it until 9:35 to get truly started, so that we can have a few more people coming in. You are welcome to either leave your camera on or leave your camera off, whatever you are most comfortable with. For the future, we are recording, just so you're aware of that. And sorry, I'm just going through a few things here before I get ready to share my screen. I want to say a quick thank you to Vicki Harris, who is my moderator for the day. So she's going to be taking a look over the chat, making sure I am, sorry, I was reading some notes from her. So she's going to be taking a look at the chat, a look at any of the reactions, any hands raised, things of that sort. I want to, I hope that you feel comfortable enough to ask questions as you need to, and she will nudge me or send me a text or yell at me, whatever she wants to do, I'm happy with in the meantime. So I know that we did have some people getting trouble logged in this morning, and I wanted to give people an opportunity to come on in. Go ahead and start sharing my screen. Once I get it settled. So many different buttons to push. I don't think as many times as I've done this, I've ever figured out a really good process of getting all of the buttons pushed in the right order without seeing the 9,000 screens I have open on my computer. Okay. Steve, since I see you, Steve Papajohn, can you give me a thumbs up that you can see my screen? Perfect. Thank you so much. I appreciate it. So I'm going to go ahead and get started. My name is Alissa Cannon. I use she, her pronouns. I am coming to you today from my home in Dover. I do have two very needy pups that I put in the bedroom with Zootopia on, but chances are my big boy will probably whine because he loves me and wants to be near me, and that's okay. So if you hear them at any time, I do apologize, but please bear with me. It's one of the amazing perks from working at home, but also one of the struggles. So again, as I said, I'm Alissa Cannon. I'm the executive director for the New Hampshire Juvenile Court Diversion Network. I'm originally from South Louisiana. I moved up here about 15 years ago, back and forth a few times, but that's okay. I couldn't decide if I liked the winters. I moved here permanently 7 years ago. Still don't like the winters, but it's a trade-off for the beautiful seasons that are here in New Hampshire. I've been with the network, the Juvenile Court Diversion Network, for almost 4 years now, but previously I worked in the public health network in Strafford County, so I have great relationships and love all of them there, the hardworking, amazing public health people and my community partners. So my connection to this topic, and I'm going to share what I feel comfortable sharing. And if at any point in time we do have a few breakouts that I'll ask you to share a little bit about yourself with each other, I want you to feel comfortable sharing what you feel comfortable sharing. It is not a requirement. So I am an out lesbian. I have been married to my beautiful wife now for almost 7 years. We've been together 10 years. Again, we live in New Hampshire. In the past, I have struggled with substance use issues, and I still work through mental health issues to this day. I have worked in the education and prevention community health field for about 15 years, thanks to New Hampshire. And one of the great things is that in the past year, I had the opportunity to apply for a fellowship for the New England Prevention Technology Transfer Center. And that was in 2021. And it was an inaugural or pilot program that was done all across New England. So all 6 New England states participated. And I am honored to have been selected as a New Hampshire fellow. So this workshop is based off of that product that I was able to create during that fellowship. My hope today is that you leave this workshop with knowledge, understanding, and tools that you can use in your own field to be more intentionally aware of and inclusive of LGBTQ youth as you build your products, as you build your strategies, your prevention tools to support these youth. This is the first time that I'm presenting this workshop, so I am welcoming of any thoughts that you have. There will be an evaluation in true public health fashion, so please be open and honest with your feedback. I want to be able to, I'm presenting again tomorrow, so I want to be able to adjust as necessary so that I can better provide the information. I welcome that. You can also put it in the chat or send it to me in a private message or an email. My email is here. As we get started, I ask that you please put your field of work in the chat, whether it's prevention, treatment, recovery, education, law enforcement, judicial system, community health, community service organization, community member, whatever field you work in. If you could please put that in the chat. I wasn't able to do the poll like I had in the PowerPoint, but I'd still like to see where everybody is coming from, please. Just a reminder that the language we use matters. We are still learning every day, but we make it a conscious effort to use people first language because words do have power. Also, but not least, I want to take a moment to recognize the land we are on. It's the historic homeland of the collective Abenaki people, which is made up of many beautiful native tribes. We want to honor this land and those who remain stewards throughout the generations. Terminology. So some terms that we're going to use today. I wanted to give you a brief overview of it. The terminology is ever evolving. And while it is important to be knowledgeable and understanding of this broad spectrum, it's most important to simply be affirming of whatever identity the LGBTQ youth chooses to express or the person chooses to express. I'll talk a little bit more later on about how affirmation is widely regarded as a protective factor in order to reduce and prevent substance use and mental health issues in teens. But just know this is a spectrum. It's not boxing people into specific identity. It is up to the youth, especially when you're working with youth, to decide their identity and then when and to whom to share it. According to the CDC and Human Rights Campaign, which is where this came from today, these terms and their definitions, the overview of sexual and gender minority. Sexual minority is someone who identifies on the spectrum of same-sex attraction and sexual contact. And gender minority is someone who identifies as a gender other than the one that they were assigned at birth. So part of this product that I was working to create under the PTTC was intentional prevention or intentional inclusion and diversity in prevention. So I utilize sexual and gender minority youth in this product. As we go through the workshop this morning, there are 3 questions that I would like for you to keep in mind. What are the teens facing? Why is it important? And what can I do to help? So I'm hoping that throughout this 1 hour that we're together, that we're going to be able to answer all of those questions. Your first breakout. We're going to do this, and I'm excited. This is my first breakout session, so please bear with me, or moderating my first breakout. I'm going to put a link into the chat to 2 Jamboards. You should have the opportunity to open both. I'm going to have to, if you bear with me, please, as I do this. Again, working through all of these beautiful controls. There are 2 things I would like you to discuss. 3 things technically. First, I'd like you to introduce yourself, get to know everybody else in your breakout room. What do you notice about the data that you're going to see? Why is it important? And what questions do you have after reviewing this data? So there are sticky notes that are already in the Jamboards. You can switch back and forth at the top using the arrows. There are 6 slides, 7 slides in one, 8 slides in another that just have data that was provided from the 2019 Youth Risk Behavior Survey. So if you give me 1 moment, again, I'm trying to make sure I have all of this situated. And as we do this, I'm seeing a lot of community mental health, prevention, education, love this, prevention. All right, great. So let me get to everyone in the meeting. I'm going to share the Jamboard links. I will share group 1's first. And this should go with you. If not, I will be sure to jump in and into the breakout rooms and do that again. So there's breakout 1, breakout 2. Okay, so I'm going to send you into your rooms. Again, I'll jump into each room, introduce yourself, and then answer those questions that you'll see at the beginning of the slides in the Jamboard. All right. You will be asked shortly to join the room. Awesome. Okay. So thoughts. You don't have to share. You don't have to talk if you don't want to. I would like for you to, but you don't have to. You can put it in the chat. I'll be able to see that as well. What did you notice?
So, Alissa, one of the things that our group noticed was, and I don't think, in having been someone who sees the YRBS data pretty regularly, you know, thanks to my wonderful coworker Vicky, the percentages of students clicking unsure was surprising to me. And I don't know, like, again, my theory behind it, and I shared it with our group, was I wonder if I'm a student sitting there and I'm just afraid to identify one side or the other. I just click unsure. Like an out. It's like an out for me, you know?
Mhm.
So just a thought. I don't know if anyone else wanted to comment on it, but it's one of the things that caught me off guard.
Thank you, Steve. That's a great thought, by the way.
I think what I was in Steve's group, but we talked just how big that number is. So it wasn't that it was like a handful of youth that had said unsure. It was such a big chunk, and that big chunk had such bigger kind of percentages than the other ones.
Very
That one
good
really
observation.
stood out for our group when we looked at students that identified as unsure and reported using a substance before their last sexual intercourse. That was significantly higher even than those that identified as LGBT. And this was just high school data, correct?
Correct. Yeah, this is just 9th through 12th grade. Anyone
Yeah, I
else want to
wasn't
share any
really-
thoughts on what you noticed? I'm sorry, go ahead.
No, I just, I wasn't really sure kind of how to really consider the data, because it did seem a little vague to me. I mean, there was a lot of, I mean, you could interpret it a lot of different ways. I mean, obviously there were things that stood out. You know, one of the things that I've noticed with my own family is that my kids are in elementary school right now, and we're in a small town in Vermont, and it's much more inclusive, and it's much more encouraging, and it's much more they take the pressure away from the kids. I mean, we, you know, in prior schools, we had to sit down with, you know, the principal and the nurse to discuss how to handle our child, and we're like, they're a child, you know, let them be and let them do, and it'll progress. And that was one experience we had. But then you know, in this other school, it's been just a non-issue, and it's been very supportive, and just kind of thinking about Steve's comments earlier, you know, there is a slowly shifting climate. I was really wondering a lot about, you know, where the data was collected, how many schools were included, you know, rural, urban, what have you. But kind of in the school system that we're in now, there's all sorts of kids just kind of floating with where they're at and just trying to figure it out. So, you know, there is that question of, like, you know, where am I, what am I, who am I? And I would like to think that kids are feeling a little safer in not settling on one thing. Do you know what I mean? With this shifting kind of thing, that they're not feeling the need to, I'm this or I'm this. My screen is over here, or I'm this or this.
I'm the same way. I'm like, which one am I looking
Yeah,
at?
so I mean, in one sense, I'm kind of hopeful that that those numbers are kind of reflective of, you know, a school environment. However, I do feel it's really vague, and they can be kind of interpreted in a lot of different ways. So
This, just so you know, I think you had asked earlier, like where it came from, how many students were involved. This is the 2019, so it's 9th through 12th graders. Was it 10? It's 10 and 12, 10 and 12th grade, right, Vicky? Or is it all 4 grades? I can't remember.
It should be all 4 grades.
All 4 grades. Okay. It comes out every 2 years. That's what it is. So, so 9th, 10th, 11th, and 12th grade, it's broken out by each year. This is a collective. I believe 2019 had close to 11,500, between 11,500 and 12,000 students across the state, that this data is representative of. Just so you know that that's how, that's where this comes from. These are all great points. Why do you feel that this information is important? You touched on a few earlier, but why do you feel that that is important and for us to look at this and to get a better understanding of what that means?
Are you
Anybody?
asking me or everybody?
Nope, anybody.
Yeah.
It's
Alyssa-
just a question to put out there.
Mhm.
Are you referring to the data broadly or one specific segment?
Anything that you feel that you want to bring up. Why is it important that we look at this data as a whole? Or you can bring up, for example, the things that both Steves talked about in
One-
terms of specific.
Yeah, just one thing that I would mention. Slide 4 talks about the percentage of high school students who did something to purposely hurt themselves without wanting to die. It mentions that 50.4% of students who identify as LGBT have engaged in self-harm behavior. And it also mentions that 33.7% of kids who identify as unsure have engaged in self-harm behavior. I feel like we tend to associate self-harm behavior with adolescents who have identified as being LGBT, but we don't really focus on the kids who are questioning. And I don't know, this was the first time that I've seen a link between kids who are questioning and kids engaging in self-harm. So why is it important? It could inform, if you work in a mental health setting, your treatment of kids who are engaging in self-harm, but it's kind of unclear where they are on their gender or sexual spectrum.
Absolutely. Thank you, Joe. I know that you talked a little bit about, not you, Joe, specifically, but everyone. You talked a little bit about some different questions that you have about reviewing the data. Do you have any others that were not mentioned here? Hearing none, moving on. All right, so that gets us into the next slide. What are these teens facing? So that's the first question that we talked about earlier that I wanted to make sure that you answered, and you saw that. You saw, so these are youth between the ages of, we'll say 15 to 18. That's about high school age, 14, 15, up to 18, who are identifying as or questioning whether they are LGBTQ. They are increasingly experiencing traumatic events, bullying, violence, isolation from their peers, from their family, from their loved ones, potentially even their communities. Now, as you saw the data, this community of youth, they generally felt unsafe in both their houses and their schools, potentially facing rejection, potentially living in a constant state of mental health trauma while they're experiencing these events. You notice that it's sorry, I was trying to think. It's a much higher rate than their peers, their cisgender, which is they identify with the gender that they were assigned at birth. Straight, which is not identifying as a sexual minority. Friends, because of their identity. So their identity being the reason why they're experiencing this trauma. In addition to all of the normal traumatic events or situations just because of normal adolescent development that teens tend to go through. So in more recent years, because we've started to analyze and take a look at this more, which is great, we're seeing that more minority gender identities and expression and sexual orientation have been facing these greater challenges. Now, that's not to say that individuals who identify on the spectrum haven't always faced adversity, but now we're seeing the growing trends of social media, more increased representation, which is a good thing. Youth are now more out to their communities. So being out to their communities means that they have presented themselves as this identity or sexual minority, and made it known. So now they're faced with this increased visibility, and they're finding all of these challenges in a lot of new spaces. So SAMHSA, which was part of the PTTC, and I apologize if you can hear my dog, which is where some of this information about risk and protective factors and the socio-ecological model come from. So this definition is pretty much easy to understand. Risk and protective factors are explained as characteristics, internal characteristics, and factors that impact substance use and mental health issues in individuals. What that means, what's happening in and around youth, both positive and negative, are impacting why they may or may not be using substances and why they may or may not be experiencing different mental health challenges. If a youth experiences more risk factors, so those negative events or negative characteristics, there's a greater chance that that youth is going to struggle with substance use and mental health challenges. If those experiences aren't met with some sort of protective factor, which is that positive involvement, that youth is most likely to continue seeing an increased chance of using substances and or suffering from some sort of mental health issue. Now, as the caring, involved adults that all of you are, we have the opportunity to surround these youth, these LGBTQ identifying youth, with positive interactions and healthy behaviors that are going to increase the protective factors within their realm of self, within who they are and what's around them. Now, one way to understand how risk and protective factors impact youth is to understand how and where these factors are present. When thinking about the risks that teens face, both internally and externally, and individually and socially, thinking about what you can do to prevent those negative risks or make it better. And then you have the concept of a protective factor. So when youth experience these adverse or traumatic events, what can you do to help offset those potential negative effects? So if you say things like provide counseling or let them talk it through or help them find a healthy alternative to that activity, then you're providing those protective factors for those teens. Making sure that you're including protective factors on the various levels, so school, community, self, those can all help with that reduction of substance use and mental health episodes that are experienced by all teens, so not just LGBTQ specific teens, but being intentional about how you, as a community health worker, as a mental health specialist, as just a caring adult, an educator, are providing protective factors to LGBTQ youth is very important. Now, these risk and protective factors show up in many areas of a person's life. It's called the socio-ecological model. I'm sure most of you have seen it. If not, just going to run through it really quickly. So the socio-ecological model shows how interconnected the world around a person is with their own self, and how the events that person experiences impacts the different levels of their life. This is a great model. Actually, that was provided by, I think it was a, who was it? The Alliance to Strengthen the Practice of Injury and Violence Prevention. but I think this model shows really great basic information about each one of the levels. So for example, individual factors for youth that can include their genetics, what they're prone to, whether it's mental health issues, whether it's substance use, their socioeconomic status, their own mental health history, and also their age. So what is their development, and how is that impacted by the events that are happening to them? Their relationship factors includes interactions with family and friends. So their small circle around them. And then looking at community, it's broadening that circle. So that is where they live, what does their neighborhood look like, how they feel connected to their community, are they involved in their community at all? What are their faith affiliations? What does their school look like? What does the school climate look like? And then societal factors are more the policies that impact youth. And then what are their cultural norms of their surroundings, inclusive of both family and community, and how were they impacted socially? So this is what Steve was talking about earlier of how is that school interacting with these youth? How welcoming and how diverse is that school when working with LGBTQ youth? Same thing with the community, same thing with policies. We're looking at, even more outside of school policies, looking at community policies, looking at statewide policies that are protective of these youth specifically. Anybody have any questions on socioecological model, risk and protective factors? Breezed over it kind of quickly, but I just wanted to double check. I know we only have 10 minutes. So your second breakout. All right. Now that you've seen the data and we've talked about why it's important, let's look at what we can do. As I mentioned earlier, I wanted to make sure you were sent away with some tools and time to reflect on how you can use this information in your own field. So in this breakout, there are 3 tasks. I want you to identify some risk factors. It can be based on the data, or it could be something that you've noticed anecdotally that are specific to LGBTQ youth may face. Then identify some protective factors that can be implemented for the protection of these LGBTQ youth. And lastly, come up with a specific thing that you can implement and you can keep this for yourself, but I am going to ask to share a specific thing that you can implement in your school, in your home, or in your community that will increase protective factors specifically for LGBTQ youth. Does that make sense? Everybody good with that? Okay. This one, we're only going to take about 5 minutes because I want to make sure that I leave some time for questions at the end or some more conversation. So take about 5 minutes, just talk it through, sending some things out into the universe. Let me make sure I'm getting into this. Okay. There we go. You may or may not be in the same group, just so you know. All right, everybody's back. So thoughts, anybody?
Something that we talked about in our group a little bit was how different kind of the risk factors can be based on where a youth lives. So in the community that they're in. So whether or not they have access to resources or they're even available. So something that I had mentioned was having access to people with the same shared life experience, and how linking people to that can either be easy in some communities or near impossible in other ones. And then somebody had also mentioned just that having that link to that one other person who's kind of in your corner and being able to really work to get that implemented so that people have have access to someone.
Absolutely. Any other thoughts?
I guess in regards to, you know, identifying risk factors and, you know, helping promote protective factors. I think that getting into specifics is really difficult. You know, given you know, you're dealing with a vast, you know, so many different communities and so many different groups within the communities. But the thing that I keep coming back to, especially in my work here in the hospital, is I think like anytime we're engaging, we really need to come from the focus, that, you know, the point of the person that you're working to, the group that you're working with. Before anything else, you should just come in with the mindset that this person more than likely has experienced trauma, and that in whichever way that you're going to be seeking to engage, it should be very trauma informed, which, you know, first principle is safety, right? Safety, and then choice, empowerment. You know, I won't go throughout the whole thing, but in order to set up a plan in how to support people, you know, we're looking to provide a way that they feel safe in reaching out, way they feel safe to communicate. And then, you know, secondary, like choice. You know, instead of saying, hey, you know, we've identified this issue, we know there's a problem, we've set up an answer for you. You know, choice and control, I think, is really key, especially when you're working with teens who naturally they're looking to break out and find their own thing anyway, and they're looking to, you know, figure out who they are and feel empowered. And then on top of everything else that's going on, how you do that, I don't really know. You know, I don't know. Again, that's really comes down to where your agency is, and
that's a great segue into the reflection that I wanted to make sure that I left you with today. I want to empower you, all of you. So if you're not in a place where you create education materials or curriculum or make policy, you can still provide that needed support and those needed protective factors for LGBTQ youth. And I know we're a minute over. This is the last slide, I promise. Affirmation. Most LGBTQ youth have experienced family rejection, which leads to negative health outcomes. Teens who are met where they are, as Steve was saying, and have adults in their lives who affirm their identity instead of trying to change it or question it, feels safer, and they feel more connected to their schools and their communities. So even if you don't know how a youth identifies, having that blanket affirmation for anyone is important, and being intentional about it, using supportive language. So making an effort to be inclusive of pronouns and chosen names. One way you can do this is to express your own pronouns when you introduce yourself. So you're providing that opportunity for youth to also offer their own pronouns and their chosen names. For example, instead of calling out names from a roster, a name on a school roster or a classroom roster may be different from that youth's chosen name. So let them introduce themselves. Example, my name is Alissa Cannon and I use she, her, hers pronouns. You don't then have to ask what every student's pronouns are, but I have opened up the opportunity and the safe space for them to provide that on their own. Visibility, including positive LGBTQ characters, references, resources, activities that are created, offering the opportunity for that teen to relate to someone or something that is like them, and include issues that are specifically faced by LGBTQ youth when discussing specifically health education. Collaboration and support, using a systems mapping tool with your coworkers. Who in your community provides support? What does this look like? Where are the safe spaces, the allies, the businesses, things of that sort? Affirming Spaces has a great business tool that, or business list that they utilize for welcoming and open businesses. Trainings, assess, ensure that educators and staff are inclusive, are responsive to and affirming of the needs of LGBTQ youth. And then policy, developing and supporting school policies that are aimed specifically at the protection and support of gender and sexual minority youth, with direct emphasis on mental health and substance use. I know I'm 4 minutes over. I apologize. You're having a great conversation. That's all that I have. Are there any questions? If you need to go, that's totally fine. If I will stay on if you have any questions. Otherwise, that's it for me. Everyone in this group is going to get a copy of the product that I had that has all of this information in it that you can sit down and work on independently or with a group. You can make copies of it if you want to sit down with your colleagues and go through it as well. It was produced on behalf of SAMHSA and the PTTC, so it's free. I make no money off of it. I wanted to have it and open it up for all of you. So any thoughts or questions? That's okay if you don't. Otherwise, please enjoy the rest of your morning. Your next workshop, I believe, starts at 10:40, so take some time and do what you need to do. Thank you all.
Thank you.
Thanks, Alissa.
Welcome. Have a great day.